the agenda we'll be working with today. I'll be going over the first few items, classification and rate structure, the industry-specific rates, and experience rating. And then Denise will take us through the remainder of the slides for injury statistics and what you can do to influence your rates. I'm going to start off with talking about some of our results for 2024. When we start talking results, we're talking about 2024 results as opposed to something more current. And the simple reason for that is that 2024 is the last full year of results that we have to go in and influence the 2026 rates. So keep in mind that if your claim cost performance has dramatically changed in 2025, it's not going to impact your 2026 rates. So looking at some of these key results, we see that the injury rate is 2.02 claims accepted per 100 person years of employment. And when we look at the return to work, we see that 79.7% of workers return to work in 26 weeks or less. And in terms of our investments, our 2024 results of 11.6% have exceeded our required rate of 4.7%. And now looking at the 2026 preliminary average industry base rate, it is remaining flat at 155, which has been the same since 2018. Now, does this mean that your premium rate or even your industry base rate is going to remain the same for 2026? Not necessarily. It's talking only about the average rate for the system as a whole. And as was the case in recent years, when the average rate remains the same, many employers will see rate decreases, others will see rate increases, and a minority of firm will see little to no change at all. In this presentation, we will visit your industry's rates. This slide provides a valuable perspective on the historical average insurance rates. It provides on one slide our rates and the costs over the last 20 plus years. The story told by the yellow line for the average base rate is that it has been consistently below the blue line, which is the average cost rate, since 2007, indicating that a history of favorable investment returns has kept rates below the cost to run the system since that time. Looking at the overall chart, we are starting to see higher costs similar to 2021 and 2015. Prior to 2015, you would have to go all the way back to 2004 to find a cost rate that was higher. Despite these cost trend concerns for now, the good news is that the 2026 average base rate will continue to remain flat at 1.55. Another message I want to tease out of this slide concerns the administration costs. As the red line at the bottom of the graph shows, the administration cost rate has remained consistently flat for the last 20 plus years, playing no role in the changes to the base rate in the yellow line above. Now let's get started on the classification and rate structure. So this slide shows how BC's economy is organized for a classification and rate setting structure. We divide BC's economy into sectors and subsectors. Most industries are then represented as a classification unit or CU. CUs are then placed into industry groups, then assigned a rate group. Now let's look at the structure in a little more detail. As mentioned on the last slide, at the foundation of our system is something called a classification unit or CU, shown here as the golden block at the bottom of the middle image. Each CU groups together businesses that do similar work, so your peers and your competitors. Now, most industries aren't large enough on their own to have a statistically reliable rate. So we group them into one of the 233 industry groups. Some of these, like forestry, general retail, long-term care, and community health support services, are big enough to stand alone. In fact, 35 industry groups are large enough to become their own independent rate groups. The rest are placed into the rate group bands that match their claim cost rate. And the scale on the right-hand side of this slide shows you the range for each of the 20 bands. So in total, we have 55 rate groups, 35 industry-specific ones, and 20 bands. That's the structure we use to set base rates. And that would be it if nothing ever changed. However, all industries evolve over time and not at the same pace or in the same way. Some get safer and others face new risks. So every year we review where every industry group sits. If an industry group's claim costs go up, they move to a higher rate group band, which means higher insurance rates. This helps ensure that each industry is paying a rate that reflects its actual risk. And it also encourages employers to focus on injury prevention. On the flip side, if an industry's claim costs go down, they move to a lower rate group with a lower rate. This slide shows the three premium rate components that drive or influence the insurance rates. First, there are claim costs, which is a significant driver. Next, something that influences them is the number of claims. And finally, we have investment returns. Investment returns are out of the employer's control, but what employers do have control over is the other two, number of claims and claim costs. These can be impacted through prevention and return to work efforts. Now let's get into the industry rates. First, a quick glimpse at the classification unit descriptions for these two industries. Starting with long-term care, this shows the general information of the description. And here is community health support services. There are more detailed descriptions of these CUs on our website. On each of these slides, there is a link in the corner that brings you to our website where you can find your CU and the related descriptions. I encourage everyone to go to our website and review your classification unit description for your specific CU. Both long-term care and community health support services form their own rate groups. And that means that they are individually each statistically reliable without the addition of other similar industries' data. Next slide, thank you. For long-term care, both the cost rate and the base rate have been on an increasing trend. The rates are projections that are based on historical data, and actual results can differ, resulting in a surplus or deficit. In 2022, the base rate rose above the cost rate to recover a deficit. Then in 2025 and preliminary 2026, the base rates were very close to the cost rates, resulting in a slight surplus position. This slide details the components which make up the base rate for long-term care. The base rate for long-term care is expected to increase by 18 cents or 4% in 2026. This is due to rising claim costs that were then partially offset by a surplus adjustment. The left side of this slide are the components that make up the total cost rate. This is the percentage of assessable payroll WorkSafeBC must collect to cover the anticipated costs of new claims that are incurred by the rate group in a given rate year, and the future cost of administering those claims. That then brings us to the right side of the screen, which starts with the total cost rate and then further adjusts for items that are specific to the CU, such as the amortization adjustment, which applies to surplus or deficit, and the industry-funded initiatives, which is the Safe Care Levy, to come to the base rate. I will have more on the Safe Care Levy in the coming slides. The community health support services industry has experienced rate increases for the last several years. Again, the rates are projections based on historical data, and actual results can differ, resulting in a surplus or deficit. Now, if you've attended a session like this before, you might remember that we usually cap rate changes at 20%. So 20% for increases and 20% for decreases. This year, we're doing something a bit different. Rate decreases will be allowed to go up to 40%, while rate increases will be limited to 10%. And these measures did apply to community health support services. The slide shows the details for community health support services, and the industry's base rate increased by 41 cents or 10%, mainly due to higher claim costs. This was partially offset by the new capping measures for 2026 that limited the increase to 10%. Again, the left side are the components that make up the total claim cost rate and the future cost of administering those claims. Then the cost rate is brought to the right side and is further adjusted for CU-specific items such as the funds related to the industry surplus or deficit, the funding policy adjustment that capped the increase in 2026 to 10%, and industry-funded initiative such as the Safe Care Levy to come to the base rate. WorkSafeBC has received a lot of inquiries about how COVID-19 claims are treated for rate setting. On July 26, 2024, Provincial Health Officer Dr. Bonnie Henry rescinded all provincial orders related to COVID-19. As a result, there is no longer a presumption that COVID-19 infections are work-related. In light of this, for the 2026 rates, the costs related to COVID-19 claims with an injury date on or after July 26, 2024, which were very insignificant, have been included in the expected 2026 cost rates. Similar to previous years, COVID-19 claims with injury date prior to July 26, 2024 have been excluded from the cost rate calculation. Now for a little bit more on the Safe Care Levy. Earlier this year, WorkSafeBC learned of a calculation error in the setting of the 2025 Safe Care BC levy and is working to correct the discrepancy. This impacted the base rates for classification units of long-term care and community health support services. The payroll data used to calculate the levy for these CUs included data from the province's health authorities. This resulted in an 8-cent reduction in the 2025 levy for each CU and a corresponding 8 cents reduction to the 2025 insurance base rates. In 2026, the additional funds to correct the discrepancy will begin to be collected through levy adjustments over an estimated 4-year period. The table below on your the table on your screen, starting from the first column on the left, shows the 2025 applied insurance base rate, so what you're currently paying in 2025, then the 2025 insurance base rate that should have been applied, and in the next column is the 2026 preliminary base rate before the adjustment, and finally in the last column, the 2026 preliminary base rate after the correction adjustment. WorkSafeBC's Board of Directors considers all feedback before approving the final base rates in the fall of 2025. If you'd like to provide feedback on the rates, please do so by September 30th, 2025. Following the approval of the rates, we will notify you of your net premium rate for 2026. If you have any rate questions, please contact WorkSafeBC's Class and Rate Modifications team at the email shown on your screen. And to learn more about your insurance rates and rate setting, visit our website on the page How We Set Industry-Based Premium Rates. Now let's get into the experience rating program. So far, we've been talking about the base rates, but the industry's base rate is just the starting point. What employers actually pay depends on their own safety performance. Our experience rating program looks at claims histories and gives employers a discount of up to 50% or a surcharge of up to 100% based on how the employer is doing. And here's how it works. We look at employers' claim costs over the past 3 years, the size of the employer in terms of payroll, and compare their claims costs per dollar of payroll to the average of the applicable industry. If the claim costs are average, they pay the base rate. If the costs are lower, they get a discount. If they're higher, they get a surcharge. To encourage stability, there are a number of dampening measures we apply to the experience rating calculation. There's the 3-year window that you see on your screen for 2026 is 2022 to 2024. And each year is weighted with the most current year weighted the heaviest. We also have a participation level and we cap some of the claim costs. On this next slide, we're going to look at an example. If your company has $1 million in payroll and your base rate is around the average base rate for the long-term care CU of 4.6%, your premium would be $46,000. But depending on your safety record, you could pay as little as $23,000 or as much as $92,000. That is a difference of over $65,000. Also, since all COVID-19 public health orders have ended, COVID-19 claims with injury dates on or after July 26, 2024 will now also be included in experience ratings. And that is all for me, and I can hand it over to Denise.
Great, thanks very much for that, Krista. So in order to reduce insurance premiums, we need to start by understanding what types of injuries are occurring and their trends over time. So in the next set of slides, we're going to look at the injury profile of the Community Health Support Services and Long-Term Care Classification Units. So this first graph shows time loss claim injury rates by CU over the past 5 years of complete data. So those are the years 2020 to 2024. Time loss claims are claims where the injuries occurred in a given year and were accepted for short-term disability, long-term disability, or survivor benefits in that year or in the first 3 months of the following year. And the time loss claim injury rate is the number of time loss claims per 100 people working all year, whether it was on a part-time or full-time basis. SafeCareBC members share these two CUs with health authorities. In addition to the CU aggregate injury rate information, we have also graphed the trends for SafeCareBC members with the health authority data removed. The black dotted line represents the BC average time loss claim injury rate for all CUs. And in 2024, the BC average injury rate was 2.02 per 100 people working. The orange line with round markers represents all employers in the Community Health Support Services CU. The rate in 2024 was 4.4, which was down from 4.7 in 2020. Below that, the blue line with diamond markers represents SafeCareBC member employers, and your injury rate was 2.9 in 2024, which was down from 4.3 in 2020. Now looking at the green line with square markers, this represents all employers in long-term care. The 2024 injury rate was 9.1, and that's down from 10 in 2020. The red line with triangle markers represents SafeCareBC member employers in long-term care, and the injury rate in 2024 for this group is 8.4, down from 10.5 in 2020. So overall, the long-term care injury rate is high and has remained high at more than 4 times the BC average, though do acknowledge we have seen a decrease most recently in 2024. So this slide shows average complete duration of time loss claims by CU for the same 5-year period. Average complete duration is the average claims duration in days, and this is just one of the metrics that can show what's driving costs. The longer the claim, the more expensive the claim tends to be. As with the graph in the previous slide, we also graphed trend lines for SafeCareBC members. Overall, the average complete duration at the provincial level and in our CUs of interest has been trending up. Long-term care average durations are below the provincial average, and community health support services durations are above. Note that the average complete duration amongst SafeCareBC member employers in the Community Health Support Services CU reached a high of 106 days in 2024. Workdays lost is another metric that we use, and it's related to this average complete duration. And we use it to measure the impact of time loss claims. In long-term care, just a note that the workdays lost in 2024 was almost 180,000 days, which is the equivalent to over 700 full-time workers missing from the sector, assuming a 250-hour workday. And in community health support services, the total workdays lost in 2024 was over 90,000, which was equivalent to just over 370 full-time workers missing from the sector. So it just really underscores what we already know, which is that preventing injuries and having effective stay-at-work, return-to-work programs is very important and can have a really positive impact in industries such as healthcare that are facing significant human resource shortages. Now this slide shows time loss injury claims costs paid by CU. And what we see here is that tens of millions of dollars are being spent annually on claims costs. While there was some improvement in the total long-term care CU in 2024, overall claims costs paid have been steadily increasing over the last 5 years. So the green line with the square markers represents all BC employers in long-term care, and the time loss injury cost for this CU was almost $48 million in 2024. That's an increase of over 50% from 2020. The red line with triangle markers represents the SafeCareBC member employers in long-term care, and the 2020 time loss claim injury rate in this CU, injury claims cost paid in the CU were 17 million, and in 2024, it was over 25 million. So again, we've seen almost a 50% increase in the last 5 years. The orange line with round markers represents all BC employers in community health support services. The claims costs paid in 2024 were $32 million, which is an increase of over 110% in the last 5 years. And the blue line on this graph with the diamond markers represents SafeCareBC member employers in the community health support services. In 2020, the claims cost paid was $2.7 million, and in 2024, it was $6.8 million. So again, we've seen a large increase of about 150% in that CU. So let's have a look at who's getting injured and the types of injuries occurring in community health support services. So this graph shows the proportion of time loss claim counts by occupation in community health support services for the past 5 years. During this time, more than 8,000 time loss claims resulting in time loss occurred. Of these, 64% were experienced by healthcare assistants, which are the primary occupation in our grouping of nurse aides, orderlies, and patient services associates. And they were followed by nurses with 13% of time loss claims. Also in the top 5 most injured occupations were licensed practical nurses, social and community service workers, and home support workers, housekeepers, and related occupations. These two charts show time loss claims by accident type. Accident type describes the manner in which the injury or disease was produced. The first chart shows the top 5 accident types by count, and the second graph shows the top 5 accident types by claims costs paid. During the last 5 years, the cost of time loss claims in this CU totaled over $120 million. Injuries from overexertion represented the highest proportion of claims counts and claims costs paid at 34% and 26% respectively. Approximately 50% of these injuries, both in terms of counts and claims costs paid, had people as the primary source of injury, and the other 50% had non-people sources like instruments and equipment as the primary source of injury. This highlights that robust ergonomics, or musculoskeletal injury prevention programs are needed that assess and control both people source and non-people source hazards. Acts of violence represents 8% of time loss claims by count and 18% by claims costs paid. The disproportionate claims costs is associated with a large proportion, approximately 70%, of these claims having psychological injuries as the nature of injury to the worker. Looking at the second graph, we see that other accidents at 13% is in the top 5 accidents for claims costs paid. This accident type largely includes many, but not all, psychological injury claims. A quick note that COVID-19 claims are captured under the exposure to toxic substances accident type. You will see that while this accident type was in the top 5 claims by count, it was not in the top 5 claims costs paid. While COVID claims did contribute to overall claims costs paid, they were not a key driver of costs and in turn insurance premiums in this CU. So now we're going to look at the data for long-term care. So this graph shows the proportion of time loss claim counts by occupation in long-term care over the last 5 years. During this time, more than 20,000 injuries resulting in time loss claims occurred. Of these, 66% were experienced by healthcare assistants, followed by licensed practical nurses with 11% of the time loss claim injuries. Also in the top 5, most injured occupations were nurses, light-duty cleaners, and food and kitchen-related occupations. These two charts showed time loss claims by accident type. The first chart shows the top 5 accident types by count, and the second shows top accident types by claims costs paid. Like we saw in community health support services, injuries from overexertion represent the highest proportion of claim counts and claim costs paid at 32% and 39% respectively. Similarly, approximately 50% of these injuries, both in terms of counts and claims costs paid, have people as the primary source of injury, and the other 50% from non-people sources. Acts of violence represented 12% of time loss claims by count and 21% by claims costs paid. In this CU, 30% of claims costs paid are associated with psychological injuries, compared to 70% in the community health support services. The highest proportion of claims costs paid by nature of injury are from other strains, which is a category of musculoskeletal injury, and that was at 47% of the acts of violence claims. In long-term care, the exposure to toxic substances accident type with COVID-19 as the main contributor represented 30% of claim counts and 7% of claims costs paid. In this section, we will present psychological injury claim trends. We saw in the previous slides that claims where the nature of injury is psychological are a key driver of claims costs and in turn insurance premiums in the healthcare sector. Every spring, WorkSafeBC publishes an update to its media backgrounder on psychological injury claims, also known as mental disorder claims. 5 years of data is provided, and it includes breakdowns by industry and occupation. So this slide provides an excerpt from that document, and it shows psychological injury only claims reported and claims allowed by subsector and CU for the past 5 years. A link to the document is provided at the bottom of the page, which you'll be able to access later through your PDF copy that will be made available. Psychological injury only claims are those that arise from a traumatic event or stressor in the workplace and do not have an associated physical injury claim. Not all claims registered receive an allow or disallow decision. Some claims are suspended and do not proceed through the decision-making process. This happens after the claims are registered and is often a choice workers make not to proceed with the requirements of the claims inquiry process, including obtaining a diagnosis from a psychologist or psychiatrist. Suspended claims may proceed at a future point and receive an allow or disallow decision. As you see here, both community health support services and long-term care has seen steady increases in both claims reported and accepted over the last 5 years. This slide shows an excerpt of psychological injury claims by occupation for the same 5-year period. The occupations experiencing the most psychological injuries in BC include nurses, social and community service workers, and healthcare assistants. In addition to psychological-only claims, some claims have both a psychological and physical injury. This slide shows an excerpt from the document of physical injury claims with a psychological injury claim accepted, and again broken down by subsector and CU for the past 5 years. In community health support services, 20% of all psychological injuries also had a physical injury. And in long-term care, 25% of all psychological injuries also had a physical injury. So it shows that continuing to invest in prevention of physical injuries will also help prevent a sizable proportion of human and financial costs arising from psychological injuries. WorkSafeBC has resources available on our website to assist with managing psychological health and safety in the workplace. And of course, SafeCareBC has a wealth of resources and supports available to you as well. So in the next slides, we're going to discuss how you can influence your WorkSafeBC premiums through injury prevention and stay at work, return to work programs. So from a high level, how do you go about reducing your workplace injuries? Start by ensuring you have identified and understand what is causing current injuries and associated costs. What are the common hazards within your industry and specific to your company? What injuries are your most frequent and most serious? What are the costs and causes of these? Then put a solution into action for what you've identified. Ensure your health and safety program has specific processes that mitigate the biggest risks and the most common and frequent injuries and the largest cost injuries. Identifying your workplace's key risks together with your employees is a great way to understand and manage your workplace risks, enhance your health and safety program, and build a strong safety culture. Joint health and safety committees or worker representatives for smaller workplaces with between 10 and 19 employees are key in the process of establishing worker participation. A trick is to unlock the potential of your joint health and safety committees. Joint Health and Safety Committee effectiveness is an area that WorkSafeBC will be focusing on in the coming years, both in developing more resources and tools to help committees realize their full potential, as well as when our frontline staff visits. WorkSafeBC provides multiple sources of data to assist with identifying the types of injuries and costs occurring both at the industry level and within your own workplaces. Industry level data is publicly available through our shared data webpage. Our industry level data applications can help you answer questions like what activities lead to your industry's most serious injuries, which occupations are getting injured, what are the most common issues and risks our inspectors see in your industry. The industry data comes with simple incident descriptions, or my apologies for sample incident descriptions, enabling you to work through the process of could this happen here, and then put preventative measures in place. Your company-specific data is provided through WorkSafeBC's Employer Health and Safety Planning Toolkit, which can be accessed through our secure online services portal. If you're not familiar with the toolkit, I strongly recommend logging in and exploring its features. We have resources available on our website to support you in navigating the system. In addition to investing in injury prevention, it is important to have and provide timely and suitable return to work when an injury occurs. The impact of timeless injuries is significant for both workers and employers. When you consider lost productivity and the cost of hiring and training new workers, the impact can be several times greater than the direct claims costs. We know that time off work to recover is necessary in some cases. We also know that prolonged time away from work can hinder a worker's recovery. This is why return to work planning is so important in an injured worker's recovery, and why early intervention and maintaining connection to the workplace is critical to improving recovery and return to work outcomes. Return to work planning starts in the workplace with the worker and the employer, usually the supervisor or return to work coordinator at the center of the process. The process starts with a clear procedure for reporting the injury and discussing next steps with the injured worker. Second, make a specific offer of suitable work. When appropriate, have the discussion with the injured worker before they leave the workplace and put the offer in writing so they can review it and, if needed, discuss it with their healthcare practitioner. Third, work together to build a return to work plan that reflects the worker's current abilities and, where appropriate, incorporates input from the healthcare provider. Continue to monitor and troubleshoot, recognizing that even the most carefully considered plans may need adjusting. Communicate and adjust the plan as the worker's function improves. Finally, follow up with the worker once they've returned to their pre-injury duties to ensure full recovery and no re-injury. To support you in preventing injuries, reducing claims costs, and building and maintaining a strong safety culture, WorkSafeBC publishes a range of resources. These include videos, books, bulletins, and information sheets. There is also a landing page specific to the healthcare and social services subsector through which you can access industry-specific resources. If you have not already done so, signing up for one of our various health and safety e-news blasts is a great way to keep up to date with the availability of new resources, as well as other aspects of WorkSafeBC business, like regulatory changes. And of course, SafeCare BC, your health and safety association, is a great resource and can be a great first step for finding specific injury prevention and return to work solutions for your workplace. And so with that, we will start with questions.
Let's see, we have a question in the chat. Someone asks, are there resources from WorkSafe regarding fatigue management? Our staff are working rotating shifts, including overnight, and some staff also have other jobs. I see Anna's dropped a few in the chat there, but perhaps you want to speak on a little bit of that?
Yes, we do have some resources available on that topic. So please go to worksafebc.com. I don't know if I'm as fast to drop them into the chat like Anna's done, but we can look to get those links and send them along after the presentation.
For sure. And if anybody has any other questions for Denise or Krista, feel free to plop them in the chat or the Q&A right now. Someone commented something in the chat, says, we get pushback from WorkSafeBC when we are trying to offer modified duties to the injured worker due to their physicians. Note stated no work for 2 weeks.
So I'm not able to speak to any given claim. What I would recommend is just please connect in with your claims contact and just have open conversations with them and discussions to move things forward and make sure that everybody is on the same page with their understanding of the state of the claim.
Getting a lot of thank yous, very well presented. Someone asks, what has been the impact on claim trends that the presumptive cause for COVID-19 has been removed?
So I think that was in my slides. Although I don't think that I looked at any trends. Perhaps that's something that we can follow up with afterwards. As far as I understand, my high-level knowledge is that since Dr. Bonnie Henry rescinded all of the health orders, there have been less significant number of claims. I see Kieran Batty's also come on camera. I'm not sure if she wanted to add to that.
Yeah, I'll add to that. So we haven't looked at claim trends specifically, but we did look at the costs that were associated with COVID costs when we made the decision to follow with the provincial health order being rescinded and treating COVID claims now as other claims. and it wasn't a significant impact on overall rates or any industry's rates. So, but we haven't looked at trends in specific. We can take that back and look into it.
Thank you, Karen.
And I'll just quickly note that I was able to find the link to our fatigue and impairment webpage and have dropped it into the chat if you haven't seen it already. So.
Seeing a bunch of things, but not any more questions. Perhaps I could speak on our upcoming events while we're waiting for some more questions, unless Denise.
Sure. And also I would just add that it was a lot of information that we presented today. Sometimes it takes some time to percolate and on the information. So at any time, feel free to reach out. I know our Safe Care colleagues can help facilitate that. So if you have questions after today, feel free to reach out and get in touch with us.